Hey, welcome to another edition of Mississippi Stories. And as you can tell, I'm in a little bit different place. I'm sitting on the couch. And no, this isn't a therapy session for me, but it should be because I've got two really smart folks with me today. And I tell you where I am. As you can probably tell by looking in the background, I am on the campus of the University of Mississippi Medical Center, and I am sitting in the office of the Mind Center. And that's right. If you've not heard of the Mind Center, it first was, I guess it was born in 2010, if I'm correct.
That's correct.
In 2010, and Mind, and this is so incredibly clever, I could have never thought of this in a million years. It stands for the Memory Impairment and Neurodegenerative Dementia Center. And folks, if your family has not been touched by dementia or by Alzheimer's, you're lucky. And it has hit mine. This is a very personal interview for me. And thank both of you for talking about this issue. And also I want to thank the folks at the Mind Center for the hard work that they have done since 2010 to not only help with awareness and education, but also with research on this, because Alzheimer's is one of those diseases that is not only hard on the patient, it's incredibly hard on the family. It is growing exponentially in numbers and in cost in this country. So I really thought, you know what, we needed to come down today and talk a little bit with Dr. Kim Tarver, and then of course with Denise Lafferty today. And I'm going to get you both to introduce yourselves officially,
Sure.
What you do here on that, but talk a little bit about the great work that's going on here at the Mind Center. So anyway, thank you. Kim, I'll go ahead and start with you. I like your white jacket, by the way.
Oh, well, thank you.
Yeah, it probably took you a
I
couple
wore it
years.
especially for you.
Oh, did you really? Oh, it's like, yes, I didn't think you could wear that after Labor Day, but that's okay. It looks really good.
So I'm Dr. Kim Tarver, and my position at the Mind Center is that I'm the Director of Clinical Services. So
Oh, nice.
I'm not a researcher, I'm a clinician, but I work closely with the researchers here and certainly stay up to date with what they're doing as best I can. So that's my function here, is to sort of direct those services that we provide as physicians, nurse practitioners, social workers, that kind of thing, to help families that are living with dementia.
Yeah, living with is a good word on there. So on a scale of 1 to 10 on the hope scale, 10 is like, yeah, things are looking up. And I know there have been some huge breakthroughs recently. I even saw an article in the New York Times yesterday talking about using ultrasound to help get medicine through the blood-brain barrier, which I thought was incredible. But there have been some huge things. Do people, I mean, are we feeling like that we're moving in the right direction?
For sure. I mean, and I think we're moving faster than we've ever moved in my career.
That's fantastic.
I've been doing this for about 30 years.
Yeah.
And so this is the first time in my career where I've thought, you know, there's a horizon out there that we may see a real change in how we manage this disease. It's not this year.
That's right.
Or maybe not even the next 5 years.
Mm-hmm.
But I'm hopeful that for the next 5 to 10 years that we're going to see dramatic changes. That's an opinion. That's just an expert opinion, and other doctors may give you a different opinion. But that's what my thinking is.
I would say your opinion would be a little better than my opinion.
Well, what I mean is that some doctors may think that we're going to move faster than that. The research that was done during COVID really kind of pushed medicine ahead in general, you know, really quickly, and so we'll benefit from some of those researchers that developed a vaccine very quickly. So I do think there's going to be a change.
Oh, that's fantastic. Denise, tell a little bit about what you do, and tell us a little bit about your experience here at the center.
Sure, absolutely. So I'm the Chief Organizational Executive here at the Mind Center. So that means I do a little bit of everything. I oversee the operations of the Mind Center. I'm involved with Dr. Tarver on our clinical services. I get involved in our fundraising, the delivery of education, and caregiver support services and all of that. So I have a real passion for what we do here at the Mind Center, because I lost my mother to Alzheimer's disease in 2009, and so, you know, the work that we do here is so important, and, you know, we're able to feel really good about the support that we provide.
Yeah, you and I were talking about that a little bit before we went on camera. Literally, this is something personal, you know?
Absolutely.
And I tell you, I mean, when family members are going through this, the fact that they know that they can do something to either help somebody else, or that is really cathartic and very helpful.
Absolutely. We are definitely fighting the fight here. And as Dr. Tarver was saying, it's wonderful to see hope on the horizon with some of the new treatments coming out. That's been very promising.
Wouldn't you say, I mean, there's literally a three three-pronged kind of a mission here, isn't there? I mean, there's research, healthcare, and education. Kind of go through all three of those steps, and if y'all want to jump whichever, I'll swivel my head appropriately.
Sure, and I can start.
Yeah,
So our three mission areas mirror the mission areas of UMMC, Center Healthcare Education and Research, and the Mind Center really got its start with a focus on research in 2010. And we have some of the longest studies looking at risk factors for Alzheimer's and dementia ever undertaken.
Oh, wow.
And those are still continuing today. And interestingly enough, we started in 2010 with 2 active NIH-funded studies, and we now have 23 NIH-funded studies underway here. So that's a big cornerstone of what we do. And then I'll let Dr. Tarver talk about our clinical services, but our other mission area is education and outreach. And so we offer quite a few educational programs, our annual Alzheimer's conference. We have a caregiver university for family caregivers, and just a lot of education and also caregiver support services to help the families
that's huge.
support their loved ones as they navigate the progression of the disease.
It's really weird. I mean, and I know from Dad's experience, I really had to learn how to redirect. For instance, when you know he would say, "Yeah, my parents are going to come pick me up today," and I'd be like, "I think they're going to probably be here tomorrow," because I knew he would reset before that time. But you learn as a caregiver and how to deal with your own stress as well. So
absolutely.
The research, and like I said, that to me that fascinates you. Have that many studies going on. Tell us a little bit about some of the things that you're studying.
You want to talk about studies?
Sure. So our cornerstone study that was started in the mid-1980s is called the Atherosclerosis Risk in Communities Study. And originally it was focused on looking at risk factors for heart disease and stroke. And then Dr. Mosley, our director, and his colleagues became more and more interested on risk factors for Alzheimer's disease and dementia. And so when the Mind Center was founded in 2010, a neurocognitive study was added to that original study. And both of those studies are still underway today. And we started with 4,000 participants back in the mid-1980s, and we still have about 1,600 of those original participants in this study, which I find remarkable. That dedication.
Some of those people are in their upper 90s.
They are.
Yeah, I was thinking they were probably in their 50s or so when they started.
Yes,
so,
exactly. And then, of course, we've had a lot of other spin-off or ancillary studies result from that study, but one of our biggest new studies is called the UMMC Mind Center Mayo Clinic Study of Aging, and we launched that in 2022, and it's going to be a large long-term study like the ERIC study, and not only is it continuing to look at risk factors for Alzheimer's disease and dementia, but also studying why some people age in a healthier way and don't develop those diseases or other chronic diseases as they age. And so we're going to be recruiting about 4,000 Mississippians into that study and study them over the course of their lifetime. So it's a very exciting study.
You can see how, Marshall, those studies, they take a really long time. And so it's not a quick process to figure out what exactly are the risk factors to a disease. And so what they have learned, what the researchers are learning and have learned, I would say over the past decade, is that there's a really close connection between brain health and heart health. And so a lot of those risk factors overlap and are the same, which is good news in a way because we've already been working on some of those. The thing that we're learning is that we need to be more aggressive about the way we treat high blood pressure, for example, at younger ages. And so sort of not tolerate even a little bit of blood pressure elevation over a long period of time. That those small changes make a difference.
So it's really important to get like blood flow to the brain.
For sure.
And oxygen, which makes a lot of sense.
And what's different about the brain is that it is made up of tiny blood vessels. And so as you might imagine, if you have atherosclerotic disease or plaques building up in blood vessels, those tiny vessels can be affected very quickly. And so I think that's part of why it's we have to be a little bit more aggressive in managing what happens to those blood vessels over our lifetime.
I mean, that's why, and the really good news on that is like if you have a family member that has, or it's in your family, for instance, and I can tell you from personal experience, and my sisters would probably agree. You know, when Dad got it, and it's, you know, in our family beyond my dad too, it's like you feel like, oh, that's a death sentence for me, you know. But if you're no, if I go out and I walk every day, I exercise, I eat right, and everything else, even though you may have it in your family, you have a chance of being able to negate the risk factors.
Absolutely.
Yeah.
You know, what we know is that at autopsy, a number of people have the findings, the plaques from Alzheimer's disease that never presented with any symptoms of cognitive decline.
Really.
And so those vascular risk factors are really important, I think. I think that's part of what that means.
Yeah.
Is that we can ameliorate some of those changes, even if we have Alzheimer's findings pathologically, there's something we can do about that early, you know. And so I spend a lot of my time in the clinic, not only talking to the person with dementia, but also their daughter who's with them. That's right. And say, let me talk to you too about what your blood pressure looks like, that kind of thing.
Yeah, and also too, when you're a family member, your blood pressure's probably up.
Yes.
Because of the stress on that a little bit. But I totally see what you're saying there, because I could see, say 10 years in the distance, you get scanned, there's some signs you may be having it down the road, and basically you get a printout on saying, okay, these are the changes you need to make in your life.
Yeah. Yeah. And that's a big long list of things that's overwhelming to most people. Yeah. And so I think, you know, doctors are sometimes guilty of just throwing that list out there and thinking that we've done our job. Where we really need to make changes in the way we talk to people is engaging that person in their own health care. What is it that's important to you? Yes. Where do you want to work in terms of your health, your brain health, your heart health, that kind of thing? And let's talk about what the next step is for you. That's right. As opposed to kind of looking at this overwhelming list of really healthy things that we ideally should do. We don't live in an ideal world. We live in the real world. Well,
I mean, you know, I think a lot of us were thinking, oh, we're ready for that silver bullet to come in.
But wouldn't that be nice?
It'd be great, you know. But I mean, in the meantime, there are, you know, obviously constructive steps that we can take to make sure that we're see, I forgot the word. So.
Healthy.
But that's the other thing.
Proactive.
Yeah, proactive. Oh, what's that mean? I've never done that before in my life a little bit. So, I mean, seriously, and I think, you know, we're talking about the cost, and I got this from y'all's website, but I've seen numbers that are very similar to this. $604 billion, you know, the worldwide cost of dementia. So this is a huge problem. Yeah. In 2010, and I think about that, when y'all started, you got obviously a very nice grant to begin with.
Yes.
The Gertrude Ford Foundation was amazing, and started you off, and that got you going. You had a really, really, really just iconic, wonderful singer come in and do a concert in 2012. And you did that. You had a lot of big concerts to do as fundraisers, but it was Glenn Campbell.
That's right.
And Glenn Campbell, of course, and if anybody's seen that, you really need to go look for the documentary and watch that, because it is, and I could barely watch it because Dad was going through it at the same time he was. But the fact that he had that muscle memory and could still play the guitar and still do that and everything else. But I mean, to me, that was almost as instructive as the fact it was a fundraising concert on that. Yeah. It's hard to believe. How long have you been? Have you been here?
Almost 30 years.
Almost 30?
Yeah.
Okay. Yeah. Okay, so you're new.
Yeah, brand new.
You're brand new, so you're a parent. And you, how long have you been?
I've been here for 10 years.
Okay,
I got here in 2013.
So you've seen a lot of growth, and you've seen a lot of changes. Obviously, you know, like I said, you got a new drug last year that really is a game changer that is actually making a difference, reducing plaque. And that's good news. Tell us a little bit about the future of the Mind Center, and I know you got a wonderful donation thanks to a wonderful family in the memory of Fred R. Adams, who passed away at 88. I guess he had Alzheimer's or had dementia, but his family just has stepped up and y'all are gonna be able to be a separate center now.
That's correct. We are so thrilled. Having a centralized clinic to offer Mind Center and geriatric services has been a long time dream of ours. And so through the gift from Mrs. Jean Adams to honor her husband, we're now going to be able to realize that dream. And we have announced our plans to establish the Fred R. Adams Jr. Mind Center and Geriatric Clinic, which is going to be located at 1405 North State Street in what some people may remember being called the Belvedere Haven building.
Yeah.
So through the funding and additional funding that we plan to raise, we're going to be able to fully renovate that building and make it a state-of-the-art center for older adults and people who are battling Alzheimer's and dementia.
Yeah. Okay, so a lot of people are watching this right now, and they're glad that the Mind Center exists here a little bit, and they're glad on the education part. So, number one, I mean, I played football. I had concussions playing football. I've had concussions as an adult. I know that's not a good thing to have because you talk about CTE and so forth on that. But if somebody's sitting there watching right now and they're thinking, okay, I really don't want this to happen, and you've touched on it already, talking a little bit about making sure your blood pressure is in check. What are just a handful of things that people can take with them from this interview to think, okay, I'm going to take better care of my brain?
So most bang for your buck probably is exercise.
Okay.
And think of exercise as medicine.
Do I need to go do a marathon exercise, or do I just go out for a walk?
So what you need to do is a little bit more than what you're doing now.
Hey, I resemble that remark.
Up to at least 30 minutes of aerobic activity 5 days a week. So
Okay.
150 total minutes in a week. It doesn't matter how you spread those out. So
Yeah.
that's that 30 minutes can be 15 minutes in the morning and 15 in the evening.
Gotcha.
Or it could be 3 days a week, longer
Yeah.
periods of time. The idea is that your heart rate is up enough that you're a little bit winded. That if we were having this conversation while I was working out, that I'd be able to stop between every few words and say a sentence.
Yeah.
But not that not that I could just talk like I'm talking now. So
Okay.
that's how you know you're doing aerobic activity. But if you're on the couch now and you're doing zero,
like right now,
if you're doing 0 minutes a week of
Yeah.
aerobic activity, then shoot for 10.
Yeah.
Start where you are and shoot for what feels like something you could actually accomplish. Because even if you're not doing the ideal amount of exercise, every little step you take makes a difference. So that's number one, I think, in terms of what you can do that will help. And work with your own limitations too. Some people, in fact, right now I can barely walk because I've been struggling with plantar fasciitis.
Oh, ow.
So I will need to do some upper body exercise that's enough that gets me short of breath.
Yeah.
So exercise, a diet that is as close to a Mediterranean style diet as possible. So lots of fresh fruits and vegetables, getting your fats in those healthy things like nuts, avocado, olive oil, and then this is a biggie for those of us in the South, switching out that red meat that we eat for healthier fish.
Watch it.
Probably not fried catfish.
You started meddling right now.
No, saying the dirty words.
Yeah.
And if you're listening in and you know that's something you can't do, fine. There's other things you can do. And so the more of those things that you can sort of stack up, the better.
Yeah.
If you smoke, stop smoking. If you can't stop smoking, smoke less.
Yeah.
If you're struggling to get sleep at night because you're just not making that a priority in your life, make it a big priority.
And I'll jump in real quick, because like when you sleep, that's basically when the Roomba goes around in your brain and cleans out a lot of debris. So I mean, you really need the sleep for good brain health.
Right.
Yeah.
And there again, the way to stress out somebody who has insomnia is to tell them to get more sleep. But there are some things that you can do.
You mean that's kind of like telling your spouse to calm down?
Right.
Okay.
But there are things that you can do, setting a regular bedtime.
Yeah.
And making that a big priority in your life because you want to have brain health and not only brain health but mental health.
Right.
So there's so many things that are affected by how well we're doing with our sleep. So that needs to be something that I check in with myself about pretty often. There's another S one: sleeping, smoking, and what's the other S one, Denise?
Stress.
That's exactly it.
Yes.
That's exactly it.
Oh, yeah.
So reduction of stress. There again.
Yeah.
How?
Right.
How do I reduce
But I mean,
stress?
things like just learning how to do breathing and
right.
doing,
So some mindfulness activity that may not be part of your life now. Pick up one or two things. Just taking some deep breaths. Say take 5 minutes out of your day at work to do some deep breathing and allow yourself to just regain some calm. That if you did that every day the rest of your life, you would make a significant difference in your brain health. So that's a biggie too. Diabetes, dementia was one time called type 3
diabetes. Yeah.
And so if you're diabetic, then certainly maintaining those blood sugar goals that your doctor is giving you is and that is something that can be done. We have good medicine.
Yeah.
Even if you're not great at eating a diet that you need to, we can manage your blood sugar pretty well.
Yeah.
We can manage your blood pressure pretty well. Decreasing that salt intake. The Western diet is extremely salty.
Yes.
If you talk to somebody who comes to visit the United States from Europe, they'll tell you, man, the food here is both sweet and salty so much that I can't eat it.
Oh yeah, and then go to England and try to eat their food.
Right,
so
right.
I don't want to hear it from them.
But there again, making
Yeah,
little changes. If you start taking out some of those really sweet things, say soft drinks.
Yeah.
I'm gonna take soft drinks out of my diet and drink water instead. You'll notice after a while, if you're getting most of your sweets from fruit instead of cake,
Yeah.
you'll notice after a while that the sweet things like cake, they taste too sweet.
Yeah.
And so you can kind of adjust your body's taste to something that's a little bit more healthy.
Well, I mean, the good thing obviously about getting, like I said, I slept in a Holiday Inn last night, but I mean, the good thing about eating like fruit, you get fiber with it, so
Yes.
it slows down the release of insulin.
Right.
That, so it's not
And again, with that diet, there's probably also something to do with the biome, that microbiome in our gut that is connected to our brain. That's really new research that we don't know a lot about yet, but I think it's going to play out in time too. But what we do know is a high fiber diet is good for you in a lot of different ways in terms of reducing your risk for cancer, and I suspect better for your brain health too.
I mean, and I think at the end of the day, and it's, and I hear this with mental health as well, that mental health is health. And obviously brain health is health. It's all connected. It's not like the brain it's not like this is sitting off somewhere off to itself.
Right.
It's all connected. So basically take good care of yourself and you're going to help reduce your chance for dementia.
Right.
Yeah. And as we wrap up, like I said, this went by very quickly. Thank y'all for taking time to sit on the couch.
Thank you.
Absolutely.
I love this a little bit. Is there anything I really haven't touched on? Because I know y'all got so much going on. I mean, that means, like I said, you've got a wonderful art therapy program down at the Art Museum.
Yes.
There's a lot of things that you do to help other people and
Yes.
help with patients as well.
Well, I would just mention if people want to learn more about what we're doing at the Mind Center,
Mhm.
they can certainly visit our website, which is umc.edu/mind.
Mhm.
Also, I would like to mention that we have a special fundraising event coming up in May the 4th. It's the Satay South
Mhm.
Wine and Food Festival.
Mhm.
And the proceeds from that are going to support the new centralized clinic. So it's a very worthy
Nice.
cause to support. And you can drink some wine and sample some delicious food. So
But just not too much salt.
not too much.
No, and not too much
Yes.
wine
Not too-
either.
okay.
Yeah, there you go. Wine in moderation,
Right,
right?
Everything in
Absolutely.
moderation.
Right.
Yes.
This has been wonderful. Thank you so much.
Thank you
And
for
like I said,
having us.
and thank you for, I've got my own bottle of Mind water too.
It's
So
very
nice.
healthy.
It's
Super
Good
brain
for your
healthy
brain.
water.
good for my brain, which I really
Yes.
definitely need that a little bit as well. And I do volunteer my brain to y'all to be able to use, because I
Well,
figured,
thank
that
you.
somebody's been trying to ask why these cartoons keep coming out of you, and you guys could figure it out.
We'll do our best
on
to try.
that note, with the Mind Center recruiting, if somebody wanted to be in one of those studies, you can call up and say, hey, I'm interested in being in that study of aging. So
That's right.
another
So
thing.
just go to the website and check that out and,
Well, and I can
contact
give the
y'all.
number. It's 601-984-6654.
I tell you what, the nice thing about sitting on this couch is, number one, I don't need to know anything. And number two, you guys just kill it on the segues. That was
Aw.
fantastic. I love that. Well, just since you brought that up, we're going
There you go.
so on that. This has been fantastic. Thank you for letting me come out and talk about this on this interview, because like I said, I know y'all been doing this for a long time, but the work that you're doing is, like I said, it's accelerating. We're pushing more toward figuring out more answers, and that gives not only relief to the patients, but to the families. Hope is such a powerful thing.
Yeah.
It really
It
is.
It really is.
Thank you.
Thank you, Marshall.
Thank you both. Hey, and thank you for watching another edition of Mississippi Stories. We're going to have another great year. Thank you for being here. You can go back and check out past episodes or look at the great coverage that Mississippi Today offers at MississippiToday.org. Oh yeah, and you can see a few, okay cartoons as well. Hey, make sure you click the like button. We'd love you to do that as well. And, until next week, we'll see you. This is Mississippi Stories. I'm Marshall Ramsey. Thank you so much.